Hey guys, down here, welcome to Podiatry Practice Mastery. Today I'm going to go over the AAPPM 2024 conference, day one. This is something I like to come to this conference every year, and this year I was asked to do a couple of lectures, but I want to go over kind of the big ideas for this day number one. I guess I'm going to start with the first big idea, which I'm a little embarrassed to say this, but I was talking to one of the other doctors here, and we're talking about shockwave, and I do quite a bit of shockwave. And he was telling me he's changed his approach a little bit to kind of keep the pain level to about a level of a 5 or a 6. And many times mine get up to like 8. And so I think what I'm going to do like after this conference is to kind of reduce the amount of intensity. And I'm also going to be going to the upcoming Curomedics conference that's coming up here in Boston, and I'm going to ask them a little bit more. But I think I may be inflicting a little bit too much pain on my patients, and so I'm a little embarrassed about that, but I guess that's how you learn. So I'm going to try it and see if the results are any different. And then the other thing I heard of, which I'm kind of excited about, is he uses shockwave with the plastic tip for sievers. So those are that's one of my big takeaways. And the other big takeaway would be to do there's a big change in terms of billing and coding for lymphedema. Now we can kind of, once it's diagnosed, or even we can diagnose it, we can do 3 compression garments per year. The idea is you wear one, you wash one, and you dry one. So I'm real excited about that for the upcoming period of time. Those are the 2 big ones, but let me go through the whole list here. A couple of ideas. One was called VideoTap, videotap.com. It's a great way to take audio and you cut it up into little pieces, video. You take a video, break it up into pieces, and you can make a whole bunch of short content. Something similar to that is called Cast Magic, which takes either audio or video, breaks it up into little pieces. And then both of these, they also can make them into blog posts, newsletters, emails, everything else like that. So for $20, $30 a month, you can really get a lot more traction out of the content that you make, and you can even train an assistant to do that stuff. Another thing is called Schedge Social, which is a social media scheduling, and then ChatGPT 0, which is a way to check if your articles look like ChatGPT or are auto-generated. And by the way, all these things that I'm talking about at the bottom of this podcast, I'm going to be putting a link to my Notion page where it has everything for the 3 days of the conference. So this is just day one. So what are the big takeaways? So I guess increasing high profit services. This is a lecture that was about how to do more, like for me it would be shockwave, Swift, amnio, things like that. So they had a couple of things, and I think an area that I really lack on, and this is something, once again, I feel embarrassed to say this, but is integrating it with the staff. Many times I come back with a lot of great ideas, and I'm not very present at my staff meetings, so this is something I want to improve on, would be, okay, going back when they have their monthly staff meetings, ask if I could do a portion on shockwave and amnio and really explain kind of why I'm doing this. So start with staff training, teach them how it works, and have the staff know what it feels like to do, and also talk about the technology and include scripts. So that would be the first thing I want to get back. So when I go back, kind of not just getting my massage on the first Friday of every month when they're doing their meeting, but actually be part of the meeting. Second thing would be incorporating it into all areas of the practice. That would mean like having an appointment time. This is kind of a neat idea. So for example, like a lot of times we start things, but we don't have, like Swift, let's say, you don't have an actual appointment block set up for that. You don't have call scripts when they're explaining it on the phone. You don't have sales scripts for like the staff to explain what the benefits and advantages and problems. You don't have treatment sheets for it. You don't have signage brochures. Like all these things can be made. And I was actually thinking I might put something together, unless anyone has it, let me know, on like a Google sheet. So each of these you could put in like all of this written out for all the things that you do, or at least the high value things. And you could just have one Excel spreadsheet. So I'm going to try to put that together and share it with you all. That's going to kind of be on my to-do list here. Next thing would be promoting it. So putting these things that you're going to be promoting on your website on a special page, write blogs about these items, do social media about these items, get patient testimonials and doctor explanations, and then build some funnels out. So funnels would be like a landing page. So this is something that I've done for kind of a while. What I do is each month I do like a high value item, and I have 12 of them because there's 12 months, and then I'll focus on like my 4 blog posts will be about that. And then my newsletters will be about that, and everything's about those kind of. So I'm doing okay with that. What I don't have is a great landing page or like free giveaways for these things. So they recommended some like guide. So I guess I do have a guide for plantar fasciitis. I don't have a shockwave guide, I have a wart guide, a Swift guide, and then making some other quizzes. I thought was kind of a neat idea. I don't know of an easy free thing you can put on your site to make quizzes, but I like that idea. And then they talked about doing emails. Now, they also talked about something I've never thought of, but like doing like a nail fungus party or like a plantar fasciitis party where you invite people about this one thing, and then you can invite other like sales reps, I guess, that you would use. You could also invite other doctors, patients, local gyms, so anywhere to get more patients in there, and then doing like a press release on it. I never thought about that idea, but I think it's a kind of a neat idea. And then finally it talks about social media, doing that, and then, so things like that. So the other lecture was about OTC, over-the-counter tips, so like how to sell more things in your office. This is something that we do. We sell a lot of different products in the office, and there are things that you can even prescribe, but patients many times will purchase them in the office. For example, you could do like cyclopirox as a prescription, or you can do a topical antifungal for the nail. I don't think any of them works. I don't do that many of them, but I guess the main takeaway from this lecture is don't make what people can afford as the basis, but have protocols, so how we do it. And this is what my treatment sheets help patients out for. So if you want to see those, you can go to patientpresentations.com, and within every presentation there's a treatment sheet, so you can see the protocol, and that'll change according to adding new things. So setting up scripts, similar to what I was just talking about before, having like scripts for this, finding kind of an inventory control. This is something we've kind of struggled with, is when we're doing products, we don't have a great inventory system or like a tracking system, like tracking it once a month and however many you have. Like when it gets down to a certain number, then ordering more. That's something we need to make it a little bit better. So that was about that. We also had a couple of lectures. There's one on AI, and such as like AI doing notes. So currently I use Morali, my scribe, but there's an idea of something called Deep Scribe, and also using AI to create ideas and things like that. This is something that I found's really worked well, especially when I have some writer's block. I like the AI that's right within WhatsApp. So there's a little AI thingy, and I just ask, like, give me ideas for 4 articles on regenerative medicine or on shockwave, and it'll give me some ideas, and I'll say, hey, please rewrite it with like a direct response type of ad that'll be catchy, kind of like clickbait. So that was kind of a neat idea. And then the other thing would be using also to make videos and different scripts. This was kind of a neat idea where you could take like a topic, like 5 shockwave tips or 5 tips to get rid of your heel pain, for example. Do those 5 tips, and then ask them to write a script, and then you record the video. And the best video prompter that I liked is called Teleprompter. It's an app on for iPhones, and it basically you turn it on and you put like a lapel mic on, and then it actually has the teleprompter going, and it has a voice recognition. So when you start speaking, it'll move the teleprompter. So that's an easy way to make video. So you could make it use AI to write it. You could tweak it a little bit, and then you could read it, and it makes it for a lot less time doing that. The next lecture was on balance assessment, balance braces. I do a few balance braces, and my favorite slide in the whole lecture was like these ratty old balance braces that are wearing out, and they have a whole bunch of like sock lint on them, because that's what mine look like. Because what happened is the current company, which is Arizona that I use them from, there's another company that does them called Orthotica, and it's a much better device, made out of leather, looks better. So what I appreciate is I remember when Jonathan Moore, they were made through Arizona, and they kind of like stole the name or something like that, and he moved somewhere else. And what I appreciate is that he got better versus getting upset. He just had better, and then the better process is actually a new app that they have that'll kind of work with your balance, and it's like an iPad that they fill out. Staff fills out a lot of it, and then you do a few things with them. The nice thing I like about it, though, is certainly it's an objective assessment. I think it'll help you to do many more balance braces, But more importantly, I like it because I already have a couple of processes based on age. So for example, like diabetic foot exams, they do them a month before and a month after their birthday. ABIs, they do them when they're 50 years or older with diabetes, or 60 years or older, or I think 70 years or old without diabetes. And then every at age of 65, you can do this balance assessment once a year. And there is a code for it as well. And you don't make much on the exam or the code, but it makes it more objective. And I think it would do many more balance braces. The same diagnoses are the same, billing and things like that. So I thought that was kind of a neat idea, was the balance brace lecture. Next lecture that I watched was on orthotics and AFOs. My biggest takeaway is when I do for orthotics and I take a picture, because a lot of times I'll scan the foot and then I'll take a picture where I want them to offload it. I like the idea of taking a black pen and marking where the painful calluses are or the bony prominences, so it shows up in the picture a little bit more, because sometimes they can't see that on the scan. I thought that was a neat idea. And then there was a lecture on the biggest podiatry marketing myths. There was a couple of good ideas. The main thing for me is I think a lot of the content I have on my website is a little bit short. I think the content needs to be expanded a little bit, and I think that's why maybe in my case things might not show up as much, because I make it because I want to make it quicker and easier to read, but you may have to bloat it up a little bit, and you can use AI for that. Like, give me an article on, like, a Q&A article on plantar fasciitis that's 2,000 words. So that was a kind of a takeaway from that. And also sharing patient stories. I think one thing maybe I could start doing is there are patients, they tell me their stories, like with their orthotics or with the shockwave. And so even if I'm not getting a patient testimonial, what I could do is I could kind of tell the patient journey. Like, they came in with Achilles tendonitis, they weren't getting better, we did x-rays and ultrasound, and then we decided to do 3 sessions of shockwave, and then they went to PT, and then 6 months later they're feeling better, and now they could get back to dancing or whatever that is. So I could share that story instead of getting a testimonial. So I thought that was kind of a neat idea of doing it that way. There was a couple of lectures. I like the marketing lectures. There was one on getting the most bang for your buck. It goes back to pitching a niche, and I've talked a lot about that. And I love Rem Jackson. He was lecturing. So talking about picking a niche, sticking to it. So my niche is, plantar fasciitis, Achilles tendonitis with shockwave, and then Swift, and then orthotics. That's my main niche. And the neat thing also, he talked about, a lot of us focus much on like external marketing, which would be like Google AdWords, local service ads that you pay money for. He said, and I have to take this to heart, he recommended first doing like internet, which would be like your website, then doing referrals, and then doing kind of internal marketing. And I think that's the key, is kind of focusing 80% of our time on that. And then once that's working well, then you can do the paid things. But you really have to have the internet, like the website presence down, the referrals, getting actual referrals from the patients, online reviews, things like that, internal marketing to your own patients, to your own doctors. And then if you have more time, doing the external. And it kind of pointed out to me a reason, again, to have like a practice rep. I really like that idea. I haven't been able to implement it. But he recommended having someone that is not actual employee, meaning it's not someone that schedules, not someone that's a medical assistant, but actually an outside person, maybe 15 hours or 20 hours a week doing that, and once a month spending time with them and going on their visits. I like that idea of having an external person and just kind of paying them. And the rate is about the same as a medical assistant, so like $20 an hour. I thought it was a good idea. He had some kind of some benchmarks for spending for your website. One of the benchmarks I really liked was like taking and determining how much you're going to invest in yourself or in your marketing. This is something I've always liked. So for example, if you are earning $300,000 a year, investing like $30,000 in yourself, I think that's a really big key. Taking 10% and investing in yourself, because it'll make you better. And he recommends even the same thing. Like if you're producing $1 million, taking $100,000 and investing that into marketing. I'm like, that's a big number. But if you did that, imagine like how much more money you could like produce in your practice. That was a good idea. There's a wound care lecture. I like the wound care lecture. The main takeaway for that is most wounds initial visits should be a level 4 visit, just because of the complexity and because of the x-rays. I think getting up to a level for if you review external results, and I think one of those would be like in hemoglobin A1C. If you can look on someone else's, like if you can through your EMR look at other results and document that, I think that's something to take away. I'm not really doing that enough. I'm doing normally level 3s, and then they talk about, or she was talking about as well, doing kind of weekly visits, and then if something changes, like if there's an infection, need blood work, skin substitute, imaging, then you would bill an office visit. And then also level 5 visits would be like when you're sending these patients to ED, or you're going to have to do surgery on them. Or if there's a person there, like a family member, being an independent historian, like if they're not the best historian, like doing a level 5 visit. So I use one of these laminated sheets that I got online about the E&M coding. That really helps me. I use it every day. So next about wound debridement, talked about depth. One thing I didn't know would be like a billing for a surgical tray. This is something I don't do, which is new. So doing A4550, so you can do it for ingrown toenails, wounds. It's like a sterile pack. Well, like I have these packs, I just didn't know I could bill for them. So that's something I'm going to start after the course here. And then the other thing, which I'm going to take away and start doing, would be like this lymphedema that I started to talk about. The main code is 189.0. I think that's a 1, or is it an L? But I think it's a 189.0 lymphedema. Put the diagnosis in there, and you can do different like lymphedema compressions. You can do 3 pairs every 6 months. So like that can really produce a lot of revenue in your practice. So that was something, and this is irregardless of of home health, because that's a big problem with a lot of DMA. They can't have home health. So and once again, this will go back to educating the staff, teaching them the process, like right, not just doing it, but teaching the staff, getting templates, and that's why I'm going to try to make this Excel for you guys to kind of go over like all these things and like how you're going to explain it, templates, and other types of things that might help you. So I'm going to work on that. So once again, all these things are my little notes for the whole weekend if you want to look at them. And on these notes, I'll also put this link to this template that I'm working on for you. Okay, I'll put it underneath this audio. Hope you guys found this beneficial, and until next time, thanks.